These changes are more important than ever. Mr. President, just today, we received a report from HHS that from the time Obamacare took effect through 2017, there was an average premium increase of 105% across the 39 states using HealthCare.gov. This is just one snapshot of the runaway costs of Obamacare, and is just one of many examples indicating why we need to act as quickly as possible to repeal and replace the misguided law. As the Senate continues to discuss the policy matters related to this effort, we'll need to confront a number of different issues as we work to provide enduring reforms for our beleaguered health care system. As chairman of the Senate committee with jurisdiction over most of the salient issues under discussion, I want to make my views on these matters very clear. First, it is my view that all of the Obamacare taxes need to go. We shouldn't be treating the Obamacare taxes as a smorgasbord, picking and choosing which ones to keep and which to discard. I don't think there's a single tax increase in Obamacare that has enjoyed support on this Republican side. And when all is said and done, the tax provisions of the Affordable Care Act represented a $1 trillion hit on the economy in just the first 10 years. That is nearly 1% of the projected gross domestic product over the same period. In my view, it would be inappropriate, after spending the better part of a decade railing against Obamacare's burdensome job-killing taxes, for us to then turn around and say that some of them are fine so long as they're being used to fund Republican health care proposals. It's very simple. We need to repeal all of the Obamacare taxes: the medical device tax, the health insurance tax, the so-called Cadillac tax, the taxes on health care savings and pharmaceuticals, and several others. They all have to go. Second, we need to fully repeal the individual mandate. There has been some talk about keeping the mandate around temporarily, if nothing else, to help shore up the new system. But as I said with the Obamacare taxes, Republicans have spent years condemning the individual mandate as an unconstitutional assault on individual liberty. We've also argued that it was ineffective and that it has failed to draw enough younger and healthier consumers into the insurance markets in order to offset the costs of Obamacare's draconian market reform mandates. I don't see how we can now turn on a dime and say that the individual mandate is now somehow acceptable because we're using it to prop up a system the Republicans have designed. Like the taxes, the individual mandate, in my view, needs to be repealed. Lastly, we need to resist any temptation to alter the tax treatment of employer-provided health insurance as part of this particular exercise. Now, don't get me wrong, Mr. President. There have been a number of health reform proposals over the years that have dealt with this issue, including a legislative framework that I drafted along with two of my colleagues. However, given the limitations we face under this current exercise, and the fact that we are not starting from a blank slate, but rather attempting to repeal a law that has been implemented for a number of years, we should be wary of the impact of pulling employer-sponsored insurance into this current debate.